My name's Nicholas Peter, medical registrar in Kent. So resident doctors are on strike again for the 5th time because our pay is 21% behind in real terms since 2008. Now, we don't believe under any circumstances any doctor here behind me is worth 21% than they were. All we're asking for is West Streeting to increase the pay of a first-year doctor who's starting life-saving treatment on your loved ones at 3 in the morning from £18 an hour to £22 an hour. And if you ask me, that's a bargain.
The headline dispute is that our pay is down a fifth in real terms since 2008. That's after the pay rises that we've received over the last few years. Inflation's been so high over that period that the kind of real terms value of what our salaries can buy has just eroded.
Wes Streeting, when he came into power, did offer us a deal of 4%, 5.4% on average, if I recall correctly, which we accepted. Now the problem is that still leaves us more than 21% behind. And when Wes Streeting made this deal, he told us our pay restoration was a journey, implying it takes more than one step. Now he got in the car with us for the deal he made last year, and unfortunately now he's jumped out the car and he's gone back home. We are no longer on a journey. All we need for him is to come back to the table and talk to us about pay, and these lovely doctors can get back to work.
Well, there's many factors, but I think it can't be understated that the NHS, according to the DARS report, has been grossly underfunded for the last 10 years to the tune of around 35 billion in comparison to other countries of the same kind of economic level to the UK. I think it's going to take a while to fix, but I think the government needs to be braver and actually tackle where the wealth is in society. You know, the economy has grown, albeit slowly, for the last 15 years since 2008, so we have to ask where is the money, and the government needs to be brave and take the money back. It's our money.
There's also just a sense of real kind of frustration from doctors about a lot of other issues as well. Our training programs send us around the country. We have a lot of kind of expenses, like we have to pay for our own exams in order to progress in our career. I think just generally the sort of underfunding and overstretchedness of the NHS makes our jobs really difficult, and people are just really fed up with that. So I think although it's a pay dispute, there's a lot of other factors that have meant we've got so many doctors turning out on strike.
Yeah. On the subject of that, the actual work itself, there's been a general, how do I put it, a kind of narrative, you could say, over the past 10, 15 years about the NHS being in a general state of decline. To what degree would you believe that's attributable to the doctor's pay, or is it more than that? Is there more that needs to be done? It's okay.
I think it's definitely multifactorial. There are lots of reasons for that. Doctors' pay is definitely one. Why would doctors stay when their pay is constantly being eroded? Last year, record numbers, more than 9,000 applied to work abroad. Now, I see it in all the time where I work, speaking to colleagues of mine, asking them what they're doing after their current program finishes, and they're telling me they're going to Australia. This is not sustainable. Even just yesterday, I was in our A&E department where I work, and patients were lined up the corridors, lined up in the middle of the room where they shouldn't be, because it was just full to bursting. Now, if you don't have enough staff to look after those patients, inevitably, care will suffer, and that's what's happening. The best way to avert that is pay doctors properly, restore our pay to 2008 levels. We're not asking for it in one go. It can be over a number of years, and that will help solve the problem.
I think, I work in mental health, and I think mental health is always kind of suffered more. It's chronically underfunded, chronically understaffed, and it's really hard to work in. I think there's this term called like moral injury, where you're trying to do your best for people, but within a system that is so stretched that you just can't offer anything.
I have the hindsight of working here back in 2017, 2018. I worked abroad for a few years before coming back, and even just seeing that difference between then and now is staggering. I feel like the quality of care that's accepted now is, in my opinion, disgraceful. I see patients in corridors every day, regularly speak to them there. I can't find rooms to speak to people privately. It just feels like it's so hard to maintain even minimum standards now.
Also, it's not about just the NHS, because there's, everyone's health is dependent on all these other things like housing and work and their environment. And so again, it's that idea of, someone comes to me because they're depressed, and, they're depressed because their home is falling apart, their landlord won't fix anything, they're out of work, or they're in a really difficult, insecure job, and I can't fix that, and getting a tablet is not going to fix that.
I mean, so many, just this week, I see patients who are coming in with severe withdrawal symptoms from alcohol. they're not getting the treatment they need, which can prevent long-term dementias. It's really scary. This will end up costing us a lot more in the long run. But people are so stretched, people are so busy. We have supply issues with basic resources now. It's honestly insane when I compare my work in Australia to here.
There's definitely people I know people who've moved into the private sector. I know people who've moved out of medicine entirely into other work, as well as a lot of people who've moved abroad. And yeah, I think that's one reason why people have been out on strike in the last few years. It's really felt like on a last gasp. People want to stay here, they want to work in the NHS, but it's become so untenable. So it's this last attempt to make working as a doctor in the NHS feasible for a lot of people. Rather than being forced out.
Some doctors on all levels, junior doctors, were now residents, and even senior consultants, making the argument that effectively the NHS now runs basically on the goodwill of the doctoring staff itself. Would you say that's a good characterisation of the situation?
I think that's a good characterisation. Staff at hospital, doctors and other staff as well, not only doctors, regularly stay late to fulfill their duties to their patients and are unable to leave if someone's really unwell and you're staying 2-3 hours late. This is a regular occurrence. And interesting you bring that up, because the current process we have for claiming any time or payback for these extra hours people work is very cumbersome. So Wes Streeting, when he came to power last year, and as part of the deal he negotiated with us, promised a reform to this process to make it easier. This was promised to be implemented in December last year. We're still waiting to hear. Wes Streeting has absolutely failed and abdicated his duty to us. And we ask him to come back to the table, talk about pay, and all of this can be over.
As a psychiatrist, I'm often seeing and assessing people, and often what they need is therapy, but we really don't have enough psychologists, we don't have enough therapy to offer them, and so I'm really stuck in what I can offer people.
We've heard from your coordinator that at the very least, offering decent pay for the quality of work that you guys give out is step one in that process. Do you feel there's anything else that should be done beyond that?
Yeah, so, at the heart of this dispute is pay. I think I can't understate that. But there's so many issues that I think could have helped to resolve this before it got to this point. We have issues with our rotas, the way we rotate, the way that the NHS is managed, which affects doctors day to day. All these things that Wes actually promised to us in writing last year, but there's been no action. And so we're cynically forced into submission. We're forced to take strike action. But there's so many things that could be done. It's all talk with Wes, and I want to see some action.
There's been a lot of speculation regarding conflicts of interest from the Health Secretary and that of the NHS itself. He's obviously received a lot of money from lobbyists that are pro-privatisation of the NHS, people who would stand to make a lot of money should it continue down a course towards further privatisation. Do you think that person is like an honest broker in these deals with you, or do you feel like maybe it's you're basically fighting a diametrically opposed fight with someone that hasn't got your best interests in mind?
Yeah, I can't really comment on claims of the claims you've outlined, but I can say I don't think he's been genuine in his negotiations so far. As I said, he told us pay restoration was a journey. He's jumped out the car. He told us he would reform our contract to allow us to claim overtime.
So I think that all funding comes down to politics, really. We hear a bit in the news now about the wealth tax. All we get told is that billionaires will leave. Where's the same argument to the doctors leaving? Where's the same argument to NHS staff leaving? So I think if the government really wanted to actually make hard decisions like it says, they could implement a wealth tax. It might require international collaboration. It's not an easy thing to do, but it needs to be done. We need to tax wealth and not working people like you see on this picket line.
So I think what I would say to the public is, we've had people asking, why do we deserve a pay rise when other public sectors aren't getting one? What I say is, we're organising, we're striking for a pay rise. You can too. Join a union, organise, get striking. We all deserve more, and we all can have more.
I think, firstly, I'm trying to speak for doctors here. I don't think we're worth less, 20% less than we were 15 years ago. And this pay rise that Wes quotes as a pay rise still doesn't take us back to pre-COVID. So if you think we're worth at least what we were pre-COVID, then please support our picket action. We want to kind of encourage people to stand up against the government, not accept the narrative that we can't pay for anything. These are all political choices. The money's there if they want to find it. Thank you.
We're very grateful for all the public support. We've been having, as you can hear, lots of beeps and toots here today, so we're really grateful for that. I think the most important thing I would say to the public is thank you for any support. And while we are on strike, please carry on attending emergency department as needed. The hospitals are still running and they're maintained safe by our consultant colleagues.
Wonderful. And any final message for the public or anyone in particular?
No, I think that's everything.